My name's Fiona and I'm here to introduce Nuuleaf Medical Group to you. Why is Nuuleaf Medical Group different to every other agency? Well, one of the things is we are part of a huge global corporation, a travel company called His Travel. They have a great reputation for customer service, customer satisfaction, and for safety records. They approached me and my team to come work for them as they wanted to set up a medical health tourism division. We looked into them, we did a lot of research, and we realised that their principles aligned with us. They're a Japanese company originally, and their principles are to be part of the community, to give good service, to give good satisfaction. And that is something that aligned with us. After working for so long in the medical tourism industry over here, we've seen the worst and we've seen the best. We've seen hospitals whose priority is to get in as many patients as possible. Profit margins are always being pushed, and it doesn't always lead to the best customer experience. We've seen agencies, again, trying to bus people in on airplanes to get more people in at one time. And again, it's not a great experience for patients. Yes, they meet a lot of people, but at the same time, it's exhausting for the doctors, it's exhausting for the nursing staff, and more errors can happen. We are a very bespoke company, so we like to take people in small groups. You will meet a small number of patients when you're here. None of our surgeons perform more surgeries than they actually have to. So our bariatric surgeons won't perform more than 5 surgeries a day. This is really important. Doctors are human. They will make mistakes, and they will make mistakes if they're pushed to the edge of their sanity by working longer hours than they have to in under-equipped hospitals, where they're seen as nothing more than another facility to be exhausted. The management team over here have spent years developing their tourism, taking care of patients, especially from Japan, Australia, New Zealand, America, so they've really honed their skills. This is something that we've honed our skills within the medical tourism industry. We have learned how to vet doctors, how to check their statistics, how to keep track of them, how to keep monitoring them. Relationships will form with surgeons and they will break off with surgeons depending on the quality of their work. They have to have the same dedication and integrity that we do. I have a hand-picked team of people that I've worked with previously. Some of them are new. So I'm lucky enough to work with a hand-picked team of people. They have the same integrity as me. They have the same ethics. They want to make sure our patients get home safe. They talk to your family members when you're here. They give reassurance. They give them updates. So we never want to make a bad call, so we push to do everything we can to reduce that risk and to take care of you. We all love our job. One of the best parts of our job is interacting with the patients. It's talking to them, it's hearing their stories. And as a foreigner that lives abroad in Turkey, it's quite nice to chat to somebody from home and be reminded of everything I'm missing. There's nobody that has a sense of humour like the people that come from your own country. Nuuleaf Medical Group, we have a vision. It's slightly different to a lot of other. When you come over here and you're dealing with hospitals and tourism agencies, a lot of them they're just like hospitals at home. They're doing their budgets on a quarterly level, they're looking 3 months ahead, they're used to taking patients in, and that's what a hospital does. It takes patients in, it performs on them, it discharges them, and that's where it really finishes. For us, we're looking at a 10-year plan. We believe that medical tourism is a huge growth sector, mainly because of the issues that are happening at home. You have high waiting lists, an inability to see doctors. There's a shortage of family GPs, and this is a worldwide problem. This is not just Ireland and the UK. Canada's having the same issues, where you're waiting a long time just to see a GP, to get a referral. So we are here to provide what is going to be a future shortage in healthcare around the world. We can see it already, long delays waiting for medical treatments. And yes, for countries like the UK or Canada where they're free, that is a great opportunity. But if you're 5 years living with morbid obesity, for a lot of our patients, they can't wait that long. We get patients all the time telling us that if they don't get surgery soon, that they are afraid of what they'll do to themselves. And that's a really sad situation. We've seen it from home where doctors prescribe antidepressants, painkillers. A lot of our patients are on high levels of these because that is the only recourse these doctors have. They don't have recourse to refer patients for psychological help, for nutritional help, for the surgery itself. So really, this is where we come in. This is where Turkey comes in as a country. So a little bit about myself. I moved here 8 years ago. I've been coming to Turkey for 20 years. My husband's actually Turkish. I've lived in Ireland, I've lived in France, and I've seen the medical healthcare system in both countries. It's funny, when I moved here first, my daughter had just burnt her hand on my hair straightener at home, and we went into Temple Street Hospital in town in Dublin, and we waited 16 hours. She was triaged and we were waiting. They said she had to see a doctor to see if there's any nerve damage. We waited. Then I went in and I begged, look, she's tired, she's exhausted, can we take her home? We were told it'd be another 4 hours, so we waited. When we moved here, we went to IKEA, we did the thing that normal people do, we bought loads of new stuff, and somebody taught me the trick of poaching eggs in a microwave. You don't do that in a new cup, apparently. The cup exploded, I got a really bad water burn on my arm, my skin was literally hanging off. I went to the state hospital here. The state hospital, not a private hospital. I was triaged within a couple of minutes, and the next day I was brought back to see a plastic surgeon specialist. All took a matter of hours. It was an hour to do everything, even seeing the plastic surgeon specialist the next day. 30 minutes to be triaged and then to be sent in for treatment, 30 minutes with the plastic surgeon. Thank God they did a great job. I've never actually needed to come back and see the plastic surgeon again, but that is the difference of healthcare over here. Even the state hospitals, I can't complain about it. I work in the private industry and I will still go to the state hospital here for most of the things I need. I moved over to Turkey 9 years ago now. I've been coming here for about 20 years. I've always liked Turkish people, the warmth, the welcome. I've been really happy whilst I've been here. I got the opportunity to work in the medical tourism sector. It wasn't what I'd worked in previously, but it was an opportunity and I took it, and I have to say I love it. I love meeting new patients, I love talking to people, I love seeing their journeys, their transformations. I'll be honest, with plastic surgery, sometimes I see patients and I think, oh my God, you're so hot, why are you doing anything? But again, it's not my choice. And to see them really happy, because I know what it's like to fixate on something. I know what it's like when you don't like something about yourself, and to be able to have the power to change that, refer more patients to us. That is how we get a lot of our business. It's basically happy patients who want to send their family members to us and keep those family members safe, and they trust us. I really enjoy getting somebody back. There's nothing better than walking into a room to find out that the companion that they brought over is one of your previous patients, and having a chat and having a catch up and seeing how happy they are with their transformation. Like anything else, it's a high demand market over here. It has become quite saturated. There is a lot of medical tourism agencies. There's a lot of hospitals doing international healthcare. There's a lot of doctors who've opened their own clinics. So there is, for any person approaching clinics over here, it can be quite intense. You can get a lot of calls, a lot of messages, a lot of information from different companies. And you get the good and the bad. There will be some and they're slating other companies and they're saying they're terrible and everything. That's not our job. Our job is to help you make an informed decision about us, about our surgeons, to give you as much information as we can. Then it's up to you to decide, to use all the tools, Google, Facebook, Trustpilot, the reviews that are out there, talk to other patients, ask if you can talk to other patients. A lot of the companies will have a support group, or they will have patients who they are willing to go and talk to other patients. Nuuleaf have done a lot of work to make sure that we have tailored insurance packages to get you over here and to bring you home safely. And if you get home and God forbid a complication arises, that you can either get treatment at home or come back to us. Your safety, your priority, that's the most important thing to us. We will meet you, we'll hold your hand, you'll know our name, and we want you to always think of us in the best possible way, so we'll take care of you.